Hello, I'm Dr. Marla Shapiro. I'm a professor in the Department of Family and Community Medicine at the University of Toronto, and I sit on the Board of Trustees of the North American Menopause Society. Today I'm joined by Dr. Victor Henderson, a former president of the North American Menopause Society, but a leading expert in Alzheimer. He directs the Stanford Alzheimer Disease Research Center and is professor of health research and policy and of neurology and neurological sciences at Stanford. So for our patients who are listening to this, the most common question that they often ask is in and around the menopause, as I notice that my memory is not as sharp, I forget names, or I can't remember an appointment, or the word is on the tip of my tongue. Is that normal, or is it cause for panic?
I think it's common in that sense. It's normal, and it rarely is a cause for panic. It shouldn't be a cause.
So that's pretty reassuring. So what happens in and around the menopause that cognition does change? Is it the menopause, or is it just simply the fact that menopause is coinciding with the advancing clock of aging?
I think it's a combination. I think it's primarily the latter. I think cognitive changes do occur during normal aging, but during the menopause, some people are more vulnerable. There's an emerging literature that maybe there are subtle cognitive changes that may be reversed after the menopausal transition. So a combination, perhaps.
So for a patient listening to this, or a family member listening to this thinking about another family member, when do the alarm bells go off that I should be bringing her in, my mom or whoever it is, in for an assessment?
Not for word-finding problems, not for the tip of the tongue phenomenon, but more difficulty remembering new information, repeating conversations, asking the same questions over again, and particularly when that kind of memory loss has a functional implication, when it's affecting job performance, when it's affecting finances, when there's some other impact on daily activities, then would be a time for concern. But that would be rare.
And a last word of advice for women listening in terms of what they can do to protect their cognition and their brain.
Great question. No clear evidence-based recommendations yet, although there's a lot to recommend regular aerobic activity. One recommendation is 150 minutes a week of vigorous activity, such as brisk walking. Another would be mental engagement, mental activity. Other is social engagement, and sort of being very engaged and active.
Thank you so much.